Welcome to Healthy Living, a program where we give you 1,000 ways to stay healthy so you can live longer. On this program, we promote personal cleanliness and environmental hygiene. We tell you how to live your day-to-day life so you stay healthy, stay away from disease, so your life can be longer and be better for it. Today's episode promised to be very, very interesting because we have the Catholic doctors in the building with us talking about the Association of Catholic Medical Practitioners of Nigeria. They are here with us, the president of this association, and should I say, okay, hold on, you will meet him and you will know why. I won't tell you who he is right now. So welcome once more and thank you for joining us. We will be right back and you will meet our guests. Welcome back. If you are just tuning in, this is Healthy Living, where we are promoting personal cleanliness and environmental hygiene. We give you 1,000 ways to stay healthy so you can live longer. Before we went on the short break, I told you that we have very great personalities in the house, starting with the president of the Association of Catholic Medical Practitioners of Nigeria, right here with me in the building. Doctor.
Thank you very much, Nelly. Pleasure to be here, our viewers. My name is Dr. Matthew Ashike, National President of the Association of Catholic Medical Practitioners of Nigeria.
All right, good to have you on this program today. It's so interesting anytime you show up in our studio.
Yes.
And it's usually a special event that brings you to our studio.
Yes.
The last time Doctor was here was on a program that we were doing, collaborating with the Archdiocesan Health Commission, and it was a great program. Medical facilities were made available to over 250 persons, and people from different parishes, communities, and even the orphanage homes were not left out. It was a great event and successfully concluded anchored by the Archbishop, His Grace Most Reverend Dr. Ignatius Kaigama. It was a great one indeed.
Yes, very, very important and very interesting program that brought healthcare closer to the parishioners and the community generally in the FCT. It impacted seriously on their lives. Many of them knew they were either hypertensive or diabetic for the first time. Many of them got treated for their ailments. They received quality health care, as well as got some investigations conducted that helped them to know their health status, the sugar level, the blood pressure, the malaria testing, HIV, and even COVID-19 tests. For many of them were conducted, and the people are better for it.
All right, thank you, Doctor. And like I said, he is a big fish, permit me to use that word. He doesn't just show up in the daytime for nothing, but here again, he is showing up in the daytime in our studio.
Yeah.
And he's not here alone. You're here again with...
Yes, I'm here with the former president of the Association of Catholic Medical Practitioners, Dr. Emmanuel Okechukwu. I call him President Emeritus.
Wow.
He's here with us.
All right. You're welcome, Doctor.
Thank you very much, Nelly.
Okay, showing up with the president in our studio, I'm sure something great is happening.
Yeah,
we are grateful for the opportunity to come here. Hello, viewers. Being at the Catholic television is good. So we're happy to come. Yes, we have something.
Okay, something is in the kitchen, something is cooking. So, President, please tell us what is happening.
Yes, the Association of Catholic Medical Practitioners, that means all the Catholic medical doctors, the Catholic dentists, under the umbrella of our association, are again holding our conference in no other place than the beautiful city of Abuja.
Wow.
And this time around, it's not just a national conference, there's an international component, because we are expecting our brothers and sisters, Catholic medical practitioners from the whole of Africa, to come and be part of this conference, where we hope to discuss very important issues seeing how we can bring more quality healthcare to our people at affordable rates, and ensuring that by the year 2030 we have universal health coverage in our society and our communities. So we are meeting here on the 1st to the 3rd of July 2021 at the Catholic Secretariat of Nigeria at the Resource Center there. So it's going to be a very beautiful event, very intellectual, very interesting. We're going to be having international participants coming from Uganda, from Ghana, and then of course our brothers from Nigeria and other parts of the continent will be part of this conference. And we hope that after deliberating on how to integrate government and the faith-based health services, especially the Catholic health services, we should be able to provide better healthcare for our people. Affordable healthcare, quality healthcare, wherever they live, wherever they work. People should be able to access this without suffering pocketiasis. All right? That means without having financial embarrassment, you should be able to access quality healthcare wherever you are. Depending on your needs, that healthcare should be available. And of course, government alone cannot do it. With our health services from the Catholic healthcare sector, the Catholic Church has so many healthcare facilities. So we want to partner. We are bringing these health facilities on the table so that government can partner with these health services and then reach out to our people wherever they are. In the most remotest part of Nigeria, they should be able to access quality healthcare. You don't need to travel hundreds of kilometers in search of quality healthcare. So that's what this conference is trying to highlight. How do we do that? How do we partner with government? We're expecting the Honorable Minister of Health to be there, the Honorable Minister for Women Affairs to be there, top government functionaries in the FCT Health Secretariat will be part of this conference. The chairman of this conference is none other than Professor Patu Tomi, who is coming all the way from Lagos with his managerial and leadership skills to come and be the chairman of this meeting with our professors and other intellectuals, so that at the end of this conference we come out with a very powerful consensus, all right, resolutions that will help to move healthcare services closer to our people. And we are going to be discussing so many other things apart from universal health coverage. We are in a pandemic.
Yes.
We are in a pandemic. We are not out yet. COVID is still ravaging many countries in the world, and so many new strains are being discovered. The vaccination against COVID is on. So we are still in the pandemic. So how do we sustain essential healthcare services? Providing these services to our people in the context of universal health coverage. COVID-19 should not make people die prematurely. Should not deny you access to your basic health care. Should not deny our kids access to their immunization. Should not deny pregnant women access to safe delivery, antenatal care, safe delivery, and so on and so forth. Hypertensive, diabetics, they should not die because they cannot access health care due to COVID. So how do we, in the context of COVID, continue to provide these essential services? That is one of the areas we are also going to be discussing in depth. Then of course, as Catholics, bioethics in whatever we do is very critical.
Yes, true.
So we are going to be looking at bringing the ethical background of our Catholic faith into our professional practice as medical doctors. What do you do as a Catholic medical provider that stands you out differently from the other general medical practitioner? What makes you stand out as not only providing medical services but also that spiritual touch that will complement whatever you're doing as a medical person, so that the health is supposed to be holistic. So as a health provider, you provide holistic health care, whether it is physical, whether it is mental, social, or spiritual.
Yes.
You are the best to provide that as a Catholic doctor. So we empower our members on how to bring in that bioethical component of the Catholic faith into their practice to ensure that they provide holistic healthcare. So a Reverend Father who is well known for his bioethical background is coming to provide that. You may know him, Father Joseph Obada.
Oh, wow.
Right?
Wow.
So he will be talking about the bioethical practices in our professional practice.
All right.
So in the context of reproductive health care. So he's coming to do all that. And we invite not just the doctors, but we invite you, all of you listening to me should be part of this conference.
Yes. All right, thank you, Doctor. The Medical Association of Catholic Medical Practitioners of Nigeria are doing so much in the community and in the society in general.
Yes.
And that is why the Catholic television is so happy, so proud, and so quick to collaborate or partner with them in whatever they are doing. And you've heard so much from the president of the association yourself, and it's something I recommend for all of us to be part of, as the conference is coming up on the 1st, 2nd, and the 3rd of July. And yes, we are also going to learn a lot from this conference. I heard we'll be talking about different aspects of health and all that. Dr. Okechukwu, please enlighten us more on the activities you have lined up for this conference.
Very well. Thank you, Nelly. Thank you, Vias, for being with us. Yes, the conference is coming at a very important time. Just to reinforce what our president has eloquently established, to add that the fact that we're going to be discussing, one of the important topics to be discussed, the natural reproductive techniques. As faith people, Catholics, the church permits us to use the natural methods of family planning. But it's moved ahead beyond faith to now the science of natural family planning. In fact, now we're promoting the public health goodness of natural family planning.
Wow.
The faith has led us to deepen our knowledge about natural reproductive techniques. So Catholic doctors are going to deepen the conversation, widen the conversation around how do people manage their reproductive health, sexual and reproductive health, from a position of knowledge.
Wow.
Now what the church has been promoting all these years, that family planning, the church is not against family planning. The church is only concerned about the ethics of the methods people use. And we are going to promote, we are promoting and we are teaching and we are using natural reproductive techniques, from the Billings methods to the symptomatological methods to the creator model NAPO technology to the novel fertility technology. These are progressive developments of natural reproductive techniques. And so the doctors are going to discuss around that to let our people know that what the church has been telling us all these years is true from a scientific position of knowledge. And so natural family planning may help the couples or the individual to know their fertility, to understand their fertility, to appreciate their fertility, and then manage their fertility based on knowledge and understanding. That's empowerment that comes from knowledge.
Sure.
So that's one of the things we're going to be discussing. Another thing we're going to do is there's going to be a pre-conference retreat. It's going to happen in Holy Trinity, Maitama, on the 19th. And there's going to be an outreach, a community health outreach to a parish in Gishiri. Again, we're going to provide, as you have mentioned, what has been done previously. It's going to be replicated in a rural parish, again, to showcase the Catholic Church's community effort, and then to also encourage our members to join the fold. The association has grown all these years very slowly, but now we're getting ready to fly. And when we fly, the world will see us. That's what we're welcoming the public to be part of our conference.
Yes, you have heard. So it's not just for Catholic alone. Catholic and non-Catholic alike. As you are hearing, you're viewing us, you are all invited to this great conference coming up again on the 1st, 2nd, and 3rd of July. All right, Doctor, I heard the opening ceremony is going to be something to look out for.
Okay,
please tell us more on that.
In the opening ceremony, like I said, we'll start with Holy Mass. Holy Mass on the 2nd of July. First is arrival, 2nd of July is the conference proper, and His Grace, our Archbishop, Archbishop Ignatius Kaigama, will be opening the ceremony with Holy Mass at about 9 a.m. in the morning at the St. Gabriel Catholic Church at the Catholic Secretariat. So subsequently, following that, we hope to go into the opening ceremony proper, where we have all our dignitaries, the chairman of the occasion, Professor Patutomi, the keynote speaker, who is coming all the way from Uganda, the assistant secretary, executive secretary of the Christian Health Association of Uganda. Dr. Roland Kesiawa will be here in person to deliver the keynote address to tell us how the efforts being made all over the continent, not only in Nigeria, but as a continent, what are we doing to advance healthcare to our people so that by the year 2030, most, if not all, of our people in the African region have access to quality healthcare, what it will do. And subsequently, there will be other plenary sessions that will be held on the other teams and sub-teams of the conference, as well as very intelligent and intellectually minded abstracts that have been submitted by our doctors, and even non-Catholics who are participating in this conference have submitted abstracts on issues related to the main team and the sub-teams. So it will be very interesting, very enriching for both the medical community as well as the general public to know what they can do as the community. What is your role? What's your responsibility in ensuring that we get to where we want to go in terms of providing quality healthcare? So it's going to be a powerful interaction of the Catholic faiths, the Catholic doctors, the non-Catholic doctors, the general public, the government officials. So together we integrate our efforts and see how we can overcome our health challenges. So it's a powerful session, and I want to believe that the general public will be interested in being part of this. And more so, the outreach we will have done before the conference, and of course we're going to have a retreat to prepare us for this conference. We'll all bring everything into this conference and round it up at the conference. So it will be very, very enriching for everybody to be there. Of course, at the last day of the conference, there will be a general meeting of members only. This is for members only, because this is where we discuss issues related to the association. Okay. All right. So how do we advance the association? And then the regional component will also be inaugurated on the last day of the conference. So it's a full package. Wow. 3 days, very busy. Wow. And I hope that our people will have time to visit Abuja and see how beautiful it is. But to be really, really beautiful and busy.
All right, thank you, Doctor. Dr. Okechukwu, you have a major team for this conference. Please tell us more about that.
The major team is universal health coverage and the role of Catholic doctor. Universal health coverage is a global health development paradigm framework where all countries in the world are working towards ensuring that their citizens are able to access available, accessible, affordable, comprehensive health care. He said so they do not suffer pocketitis, where we are needy and you don't have money, you die because you don't have money to get health care. So people do not suffer what we call catastrophic expenditure. They do not have to suffer because no money and a woman in labor that cannot get to the hospital. This is what the universal health coverage paradigm is hoping to achieve. Set up systems, mechanisms, community level efforts so that people will have access to healthcare. And one of the aspects will be discussion about health insurance, community health insurance, voluntary health insurance. But, some people have to have just some minimum investment in their health so that if they are sick, they don't have to be helpless. That's what universal health coverage is all about. Driven on the background of what we call primary health care. Secondary, tertiary for bigger things, but primary, everybody should have access, no matter how small. Blood pressure, sugar level, all these things, cancer screening, malaria, those are things that should happen not too far at the teaching hospital, not too far at the general hospital. How can we ensure this? These are part of things we're going to be discussing, and it's important to re-emphasize this aspect of what we call the government and church collaboration. Examples exist where the government has partnered with the church, and the examples are very massive, are very encouraging. We are now bringing it to the national space. Where can we now see the federal government partner with all church, all missionary, Muslim, Catholic, non-Catholic, faith-based health services, so that the social services function of the government can be driven by those who naturally, by their own missionary zeal are already doing it. So capacitate them to do more for more people, for more places. That's part of the universal health coverage agenda. And we're grateful to be part of this.
Wow.
Yes.
That's right. Okay, doctor.
Yes, and just to add to that, very important is the health insurance. And we are bringing the National Health Insurance Scheme, the FCD Health Insurance Scheme, are coming in to also discuss with us how we can work together with them. How they, what strategies are they doing on their own to bring healthcare closer to the people? The same goes with the National Primary Healthcare Agency. They are going to be there with us to see how ready are the primary healthcare facilities to provide this, and then how will they bridge the gap? How do we bridge this gap with our own faith-based health institutions who are providing these services right there in the communities?
All right. There you have it, viewers. What else can you ask for? While you were sleeping, the Catholic doctors are working around the clock, putting your health in mind and trying to do as much as they can so that you can stay healthy and live longer. Okay, that's so much we can have on the program today, but we won't go until the president, looking so young. You're going to share with us what is the secret of your being young. Share with us.
You can see I smile a lot, I laugh a lot.
All right, smile a lot.
Yeah, you know, you gotta smile to make yourself look stronger and healthier.
Okay.
So feel good, and what is beyond you, don't take it to sleep. Leave it to the Almighty God who knows it all and does it all.
Okay.
So don't overstress yourself.
Okay. So we want to say, smile more. Don't worry about a thing. Leave most things or all the things you can't handle in the hands of God, and God will take care of them for you, so that you will be looking as young as president of the Catholic doctor. All right, President Emeritus. Oh, you do some exercise, please. Just one. Briefly, what kind of exercise you do? You engage in?
I take brisk walk. Walk a long distance.
That's right.
And sweat. Wow.
Once you sweat while walking,
yes.
Wow. All right.
Yes, and
thank you.
Eat right.
And eat right.
Basic nutrition, the veggies, all right, the fruits are very important.
Okay.
Okay, take adequate rest.
All right.
All right.
Okay.
And once you can combine this basic lifestyle, you will live long, you will live healthy, and you will smile all the time, you know.
All right.
Yeah.
All right. Thank you very much for coming on this program, President Dr. Matthew Ashikinu and Dr. Emmanuel Okechukwu. Thank you so much, and bye, viewers. We'll see you again soon.
See you in July.
Yes, see you in July.